Centre orientation to your simulation mannequin. The Sim Centre has a large variety of simulation mannequins and will introduce you to your mannequin at the course. But for the purpose of today, I'm going to introduce you to SimMan 3G. Understanding the capabilities and the limitations of your mannequin will help improve the fidelity and your simulation experience. So I'm going to introduce you to Frank, and we're going to discuss his capabilities of his airway, breathing, circulation, and disability. So Frank has an anatomically correct airway. We can recreate a variety of different airway concerns that you'll be able to manage appropriately. We can make the active intubation easy, difficult, or unachievable, like in a can't intubate, can't oxygenate scenario. We can create laryngospasm, pharyngeal obstruction. We can make the tongue swell, which you'll be able to see when you open the mouth and visualize the swelling of the tongue in the airway. We can add trismus, which is demonstrated by Frank's tightening of his jaw. And we can also decrease the range of cervical motion, which you'll see some flexion of Frank's head as he becomes more rigid and difficult to intubate. In regards to his airway management, you can perform standard airway opening maneuvers, we can suction, you can pop in airway adjuncts. We can intubate Frank, and a video laryngoscope will be made available for you. He likes a size 7 ETT, and you need to use a spray lubricant, not the gel lubricants. You can pop in an eye gel, you can pop in an LMA, and they'll work effectively. And you can also perform a surgical cricothyrotomy, so use a scalpel to cut the neck skin. To confirm your airway placement, you can look for equal rise and fall of the chest, you can auscultate for breath sounds, and you can also get an end-tidal CO2 trace. So just attach an appropriate monitoring device, touch the screen, and a trace will appear. So now we're going to have a look at Frank's breathing capabilities. So Frank can breathe spontaneously. We can alter his respiratory rate, so what you see and what you count is a reflection of his respiratory function. As you can see, he has visible bilateral rise and fall of the chest, and we can make that symmetrical or asymmetrical. You can also auscultate his chest, and he's best listened to anteriorly, and you can hear wheezes, crackles, or even an absence of breath sounds. If you want to get a SATS tracing, you just need to pop an appropriate monitoring device on Frank and touch the screen. If his SATs fall below 60, you won't see a number on the monitor, and that will be indicated through cyanosis, which is a blue perioral light in Frank's mouth. If Frank's ventilation is ineffective, you can manage accordingly. You can bag valve mask, you can attach appropriate oxygen, and you will see bilateral rise and fall of the chest. In the case of any thoracic emergencies, you can perform needle thoracentesis bilaterally, and you can also perform bilateral finger or chest thoracostomies. So let's have a look at Frank's circulation. Frank has bilateral palpable pulses. He has carotid pulses, radial, femoral, popliteal, dorsalis pedis, and posterior tibialis. It's a push to start mechanism, so you just need to gently press to activate it, and then you'll be able to feel the pulse. Try not to push too hard, as you will obliterate it. If you want an ECG on Frank or some monitoring, just attach your leads, touch the screen, and you'll see a rhythm. You can also take a blood pressure. Again, just apply an appropriate cuff and hit start. Don't forget to set your frequency of intervals so you get a regular blood pressure. In the event of cardiac arrest, you can perform chest compressions, you can apply pads, and you can defibrillate Frank. Just make sure that you follow safe defib practices. You can also cardiovert, and you can pace if needed. Intravenous access can be obtained, although frequently you'll get given a false cannula. Medications and fluids can be administered through that cannula, so you can use appropriate dosages and rates. If you want to get blood, you can also draw back blood for blood gases and results. If you're unable to get IV access, you can go for an IO, but only on the left proximal tibial landmark. So now let's go to D, and we'll look at Frank's neurological capabilities.
Hello, lovely Sim team. My name's Frank. I look forward to seeing you on the day.
As you can hear, Frank can also talk to us. He can be conscious, alert, with his eyes open and responding to questions. He can also have his eyes closed and be unresponsive. His pupils are reactive to light, so you can use a pen torch, and the shape and size can change asymmetrically or symmetrically. Frank can also seize, which is simulated by some shaking of his upper extremities. We can take Frank's temperature, however that will be simulated and the response given to you. So that brings us to the end of Frank's capabilities. I hope that you have found this useful in understanding the functions and capabilities of SimMan 3G. The Sim Centre team and Frank hope you enjoy your simulation.